Hi, good evening.
Hi,
Good
hi.
evening. Hi, good
Yeah, good
evening.
evening.
Yeah,
How are you today?
I'm doing great.
Okay.
I'm doing great. And so you are still suffering from the cough?
Suffering. Suffering,
Uh,
what does it mean?
suffering mean like you still you still getting cold, cough,
Yeah. I I still have cough,
cough.
cough,
Okay.
cough.
So. Mhm. So
Uh,
how was your daughter today?
uh, she 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 still
Okay.
she was still ill,
Hmm.
and so that today I I didn't take her to school
Mm,
because she she cried so much,
she cries a lot.
and maybe she she was afraid of school. So
Okay.
I decided uh, 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 um,
She leave her
uh,
home.
leave leave
Yeah.
her home,
You
and
decided
she
to let
will
her stay at home.
yeah, and my daughter will come back to school on Monday.
Hmm. Yeah. Yeah. That's true because I remember when I was a child, every time I had to go to school, I usually cry a lot because I was so lazy at the time and I didn't want to go to school, especially in the morning when I was still in the bed and my father wake me up and then he makes me stay up and go to school, which is the thing I hate the most when I was a child. Uh, this kind of thing is very normal to kids. So
Yeah.
so how can you manage this kind of situation?
Many
How
manage
can you handle this situation?
uh, what are you talking about?
So, for example, your daughter doesn't want to go to school. So,
Ah,
how can you handle it?
uh, I I took her to school and I stay and I play with her a few minutes,
Mm-hmm.
and I had some her friend play with her to play with
Uh-huh.
her,
Mm-hmm.
and when she didn't pay attention me,
Oh,
and
wow.
she with her friend, and I uh, I uh, I went quickly. uh,
Ah,
yeah, and after that, I stand outside her class
mm-hmm.
and
To look
follow
at
her.
her.
Yeah, and I saw her cried very much, and her teachers um, uh, hold her and play with her, and after that, maybe uh, one 1 or 2 hours, she keep quiet and she can play with her friend.
Mm. And after that, you went back home.
Yeah.
Okay.
And because her class near my house, and sometimes I went to her class and uh, follow her. And
Mm.
if she don't cry, didn't cry, I come back home.
Okay.
And sometimes uh, I send message to ask her teacher about her.
Wow,
Yeah,
that's a lot of
because
work.
because I was very I very worried about her, and I couldn't do anything because I'm
Mm.
very worried.
Oh my goodness. Wow,
Yeah.
that's a lot of
uh,
stuff.
yeah.
Wow.
um, when you when you when
Okay.
you have a kid, you will understand this feeling.
Okay. Mm.
Yeah.
Maybe in the future when I have a family and then I have a children and then I will understand, I will empathize with your
Yeah.
emotion. Okay.
Emotion.
Emotion, you know what does it mean? Emotion mean feeling. Uh,
Yeah.
this is an other way to describe your feeling.
Okay. Now
Okay.
we can
Okay.
start our lesson today.
So as always, you're gonna be the one who reads the entire conversation for me. Okay.
Yeah. Good morning, Miss Jones. What seems to be the problem?
Mrs.
What, Mrs. Jones? Good morning, Mrs. Jones. What seems to be the problem? Well, doctor, I've got a sore throat and a bad cough. I've also got a headache. How long have you had these symptoms? About 4 days now, and I'm feeling really tired too. It sounds like you've got the flu. Take 2 aspirin every 4 hours. You should
Aspirin.
also aspirin. Aspirin. Take 2 aspirin every 4 hours. You should also get lots of rest and drink plenty of fluids. And if you don't feel better in a couple of days, give me a call. Thank you, doctor. If you're feeling ill or have a medical problem, you can make an appointment to see the doctor. In Britain, the place where doctors see their patients is called a surgery. In America, is a doctor's office. When you arrive for your appointment, the secretary or receptionist will probably ask you to wait in the waiting room until the doctor is ready to see you. When you finally to see the doctor, he will usually begin by asking you to describe your symptoms. He may then give you an examination and take your blood pressure, for example. If the doctor knows what's wrong with you, he will give you some advice and perhaps pre-
Prescribe.
prescribe some medicine. You will have to take the prescription to the chemist to get the medicine. Hopefully you get well soon.
Okay. So uh okay. Aspirin. Aspirin. Aspirin.
Aspirin.
Okay.
Aspirin.
Probably.
Probably.
And prescribe.
Pre-
Prescribe. Mhm.
Prescribe.
Yeah, okay.
Prescribe.
So now I'm gonna give you some question related to the video. Okay. So
Yeah.
what is Mrs. Jones' problems?
Her problem uh, uh, sore throats and a
So
bad sore throats
yeah.
and a bad cough,
Mhm.
cough, a bad cough, and she also got a headache.
Yeah. Okay. So how long has she had those symptoms?
She had those symptoms for 4 days.
Hmm. Okay. So what is she having?
What is she having? She, she what is she having?
Hmm. Oh,
I
you also answered
I
me already. Okay.
I
So I think that question is not necessary.
yeah.
What did the doctor tell her to do?
The doctor told her that she should take 2 aspirin every 4 hours,
Hmm.
and she should also get lots of rest and drink plenty of fruits.
Hmm.
And if she doesn't feel better in a couple of days, she should give doctor a call.
We call that fluid. Okay.
Flu,
Fluid.
fluid, fluid,
Fluid.
fluid.
So fluid, what does it mean?
Fluid is the water or um, is some type of water.
Yeah, okay, that's right. So now I highly recommend you to drink plenty of fluids, okay,
Yeah.
and uh, take rest as much as you can because now you got a cough for quite a long time.
Yeah.
Okay,
Thank you.
you're welcome. So what can you do if you are feeling ill?
Uh, if I feeling ill, maybe
Okay, you can tell me. You can tell me your experiences
yeah.
right now.
Um, I before when I was single, I I also I always uh, didn't take medicine if I was ill
Wow.
because I I I almost didn't take care about my health,
Take
my
care of
healthy, take care of my healthy,
my health.
my health. But when I have a daughter, and when I have my daughter, I I think I need to I should protect myself
Hmm.
because I have to I have to be I should be strong
Hmm.
to take care of my daughter and my family. So now, where if I were ill, I I take medicine and take a rest when when I don't don't to when I have free time, and I think I prefer eat fruits than take medicine.
So why since you have a daughter, you started becoming aware of yourself, and you don't want to get ill? Why is that?
Because I think if I were ill, or if I don't have health,
Mm. If you are not strong enough.
yeah, if I not if I am I'm not strong enough,
Okay.
yeah, if I am not strong
Yeah.
enough, I can't do anything, and uh,
So
I have to take care of my daughter.
okay. So I just want to challenge you a little bit. Okay.
Yeah.
Don't worry. So the first reason why, one of the reasons why since you become a mother, you started becoming aware of yourself is that if you are not strong enough, you cannot do a lot of things, because right now, you not only take care of yourself, but also you have to take care of your daughter. And another thing is that you don't want your daughter will get infected by your disease. Infected, you know?
Infected? No.
Infected, that is a very useful vocabulary when we talk about disease, when we talk about something that can be very dangerous. So, not dangerous. When we talk about disease like cough or flu, infected,
Infected.
infect.
Infect.
So, for example, infect means to pass a disease to a person, from a person to another. Okay?
Infect. Yeah.
Infect.
Infect.
You don't want your daughter will get infected by your cough or something like that. That is the reason why you have to make sure that you are always strong enough in order to not only take care of your children or your daughter, but also you cannot pass your disease to your daughter.
Yeah. Get infected.
Mhm.
Okay.
That is a useful, very useful vocabulary, and I guarantee that you really want to say this one, isn't it?
Yeah.
Yeah. You really want to talk about something like this, but you don't have vocabulary to describe your situation, right?
Yeah.
Okay. So, what are the places where you meet the doctor in Britain and in America?
What are the place where you
What are the places name?
in Britain, the place where I meet the doctor in Britain is called surgery,
Surgery.
and surgery, and in America is a doctor's office.
Mm-hmm.
Yeah.
Yes. Oh my God, it's so cute.
That
Mhm. So, what will the secretary tell you to do when you get there?
If the secretary will probably ask me to wait in the waiting room until the doctor is ready to see me.
Yeah. Okay. So, what will the doctor do if they know what's wrong with you?
If the doctor knows what's wrong with me, he will give me some advice and perhaps prescribe prescribe
Please, yeah.
prescribe
Prescribe.
some medicine.
Uh-huh. You can say like the doctor would probably prescribe you some medicine, or they will give you some prescription. Mhm.
Yeah.
In order to give you to have a bill, and in that bill you can go to the pharmacy shop and get the medicine. In this lesson we call that chemist. Chemist is the person who is in a pharmacy shop who sell medicine.
Pharmacy shop. Chemist. Yeah.
So pharmacy shop is the place where you can buy medicine.
Yeah.
You know pharmacy? Pharmacy shop. Okay. We call that pharmacy shop.
Pharmacy shop.
Or maybe you can say like pharmacy. That is not, you don't need to put shop here. Pharmacy is okay.
Pharmacy is
So
the place.
Yeah, pharmacy is a place where you can buy. Where you can buy medicine.
Yeah.
But you need to take the prescription from the doctor. Okay, because without the prescription from the doctor, it's really hard for you to get medicine from the pharmacy.
Maybe it's in America or Britain, but in Vietnam, we can buy we can buy any medicine without prescription.
Yes, yeah, but I think it's for adults. It's not for children because right now I have a nephew. And a few weeks ago, my sister told me that I need to go to the hospital to buy some medicine for my nephew. And at the time, I went to the hospital and I buy. My sister always also told me the name of the medicine, and then when I told to the doctor, when I told to the chemist, and they didn't want to sell me the medicine that I want to buy. So what do you mean that if you want to buy the medicine for children, you need to have the prescription?
No, that
really?
is you buy medicine from at hospital. If you go to
pharmacy.
Okay. You can buy any medicine without prescription for the kids.
Yeah. because right now my nephew is just 7 months years old.
Yeah.
So
because when my daughter was under 1 year, I can buy some medicine from at pharmacy without prescription.
Prescription from the doctor. Okay.
Yeah.
Oh, I actually didn't know that. Yeah. Yeah. So yeah.
In Vietnam, it is
Convenient. Is that what you mean?
I mean, in Vietnam, it's not. I don't know how to tell you.
Can you tell me about in Vietnamese about that? And I will help you translate your ideas.
Tức là cái tình trạng mua thuốc mà không có đơn thuốc ở Việt Nam thì nó là chuyện quá là bình thường, và nó không được nghiêm ngặt như ở nước ngoài.
Okay. So buying medicine without prescription from a doctor in Vietnam is very normal. It's not as strict as in America. Okay. Buying medicine without prescription from doctor in Vietnam is very normal. Okay. So anyway, so because I see that one of the things that you need, because I think that you actually don't have a lot of problem with your pronunciation. So if you want to enhance your skills, if you want to improve your skill more, you need to read and listen to English more. So for example, you need to make English be a part of your life so that you can immerse yourself in English every single day, and you can learn vocabulary automatically, naturally, and then you will have more vocabularies to describe your ideas. So yeah. So I highly recommend you to read books. I also have a book like this. Okay, let's see that.
Okay, I will take a photo.
Yeah, this is a book for children in America. Okay.
Okay.
You can see that. Yeah, it has a lot of picture.
Okay.
This is an English book for children in America, but we can use it. It's very helpful because it has a lot of places for vocabularies. It's very useful because one of the reasons why I want to recommend you this book is because I find it. I was amazed by how simply a language can be used to describe almost all the situation in our life. We don't need to use complicated or typical vocabularies to describe our ideas. So that you should buy it, because maybe in the future you can read it for your daughter, but you can also learn at the same time.
I really want to find a book that have two language, Vietnamese and English. That I can learn myself when I read this book. I am finding. I'm looking after some book.
You are looking for.
Looking for. Yeah, I'm looking for.
Look after means look after mean take care of.
Yeah. Bilingual books.
Okay. Okay. You look up. You look it up. Yeah, you can see
But I
that
don't.
it has a lot of. It's not. It has a lot of picture on this kind of
Yeah.
books.
Okay. Okay.
Yeah. So you can see that every time I communicate with you, I also use. I often don't use difficult vocabularies because of this book. I learned from this. Yeah.
Okay.
And you can see that I almost describe all of the situation in our life without using the difficult vocabularies or complicated grammar structure. And see, you can, because of this book.
Okay.
Yeah. So okay. Anyway, so that is the end for the lesson today. So the homework that I want to give you today is to record the conversation again, because I actually don't think any kind of homework that I can give you to improve yourself more, because you actually uh, you are actually fine with your pronunciation. The most important thing is that if you want to move on to the new level, you want to get over your situation right now, your ability of your English right now. You need to keep practicing not only your pronunciation, but also you need to enrich. You need to accumulate vocabularies at the same time.
Yeah.
Yeah.
When you ask me anything and when I answer you, uh, I was thinking about my idea and I was thinking about grammar, how to use verb or how to use
Okay.
grammar, and as you see,
Yeah.
your
Don't worry. That is a process of learning a language, and the more you practice, the more you feel comfortable when you use the language. The more you feel free when you use the language. Don't worry. Keep practicing every single day. That
maybe
is what I mean.
I need to spend more time to read book.
Yeah.
And learn more about grammar.
Yeah. Actually, you don't need to learn a lot of grammar points. You just need to learn some basic one in order to communicate very well in our daily lives. You actually don't need to learn more, but you need to make sure that you actually know how to use the basic grammar effectively, and probably that's the point. Because sometimes you think that you know how to use, for example, present tense or past tense, but maybe I'm not sure that you use it in the right way. That's what I mean. So what I mean is, you just need to make sure that you know the basic grammar, okay? But you have to make sure that you know 100%.
And there in many simple sentences, it's very easy. But when I speak, when I speak, I don't know how to organize the words on sentence.
Yeah.
Sometimes it's I don't know how
It's
to
messy.
arrange.
It's sometimes your sentences are disorganized. Is that what you mean?
For
Disorganized.
example, when I speak a simple sentence, I don't know how to organize the word in the sentence.
Yeah. So that's why you need to read and listen to material in English, because by doing this you will learn automatically and naturally. Okay, because if you're trying to remember which order you need to put in the sentences, I guarantee that when you have a conversation, you will struggle to come up with an idea which one you need to put first and which one you need to put later. Because when you have a conversation, when I talking to you like this, I actually don't know. I actually don't organize my ideas like I need to put now in the first of the sentence and verb after that and object after that. I actually don't know. I actually don't do that. The way I do is that I listen to English every single day. I read English every single day, and by doing this, I absorb, I learn, I consume the information in English automatically, and after maybe, but it takes time. You need to be patient with yourself. It takes time in order to to incorporate all of the information into your brain, and after that you will produce the language like the way you want.
Yeah. Okay. First,
So,
I will look for the book you give me. Yeah. Okay.
Anyway, see you tomorrow.
Okay. Thank you, teacher, and
Yeah.
see you tomorrow.
Yeah, see you tomorrow.
Oh. Yeah. Okay. Okay. Thank you. Bye.
You are about to tell me that I forgot to tell you homework, right?
No. I think tomorrow is Saturday.
No, tomorrow is
Okay. Friday.
is the last day of the week.
Yeah. Okay.
Okay.
I'm sorry.
No
See
problem.
you.
Good night.
Good night.